Hello beautiful, welcome back to the channel. My name is Princess Kelvin. If this is the first time of you seeing my face, you are welcome. But if you're a returning subscriber, you're a returning viewer, thank you so much for always tuning in and always watching my videos. Okay, so today in this particular video, we are talking, from the title you already know, we are talking the do's and don'ts of clinical posting or internship. That is basically what you should do and what you shouldn't do while on clinical posting or while during internship. So if you're a nursing student, you've already graduated and you're about to go through internship, or you just want to know this information for future purposes, please stick around and watch the end. And yeah, I'm very sure that by the end of the video you get one or two things from it. So let's get right into the video. I remember the first time when I was posted to a particular ward while I was still a student. Um, that first particular day, I was tense, I was nervous, I was not feeling it. I was not excited to be there. I don't know, maybe some people will say their first day they might be excited, but me, I was not excited. I felt like, "Ah, this day has finally reached, and I will start actually putting in the work and all." So I dressed up. We dressed up like I and my colleagues went to the hospital, and then they posted me to the first thing they posted me to was female surgical ward. Female surgical ward, and the cases I saw there, I felt like I was too young. Like, I don't know, but I know I'm being silly, but I felt like it was traumatizing in a way. Like seeing all those things all at once, and that it was traumatizing in a way, because after that first clinical experience, I was like seeing, oh, like, is this nothing for me? Are you sure I can do this? I was not feeling that. I had to even like talk to people about that. So it was, my first day was traumatizing to me. But yeah, moving on, we are here, thank God. so so yeah, the do's and don'ts of clinical posting or internship. So the first day, please, the first day, come prepared, be prepared in what you carry, your basic essentials, your stethoscope, if it's compulsory for you guys to carry, because like us, when we started, it was not compulsory because the hospital already has stethoscope. But there are some schools it's compulsory for them to have their stethoscope, their breast wash, their what again. Obviously, you have your pen and your jotter. So just come prepared and come early. That one just basic common sense. Just come prepared, come early, so that you will avoid having any tension between you and maybe your senior colleagues or your senior nurses. So just so that the whole process might just be smooth for you. Obviously, dress well. Normally, you know nursing. You know how nurses will dress. If you're a female nurse, you know at least for this part of the country, um dress well. If it's the uniform that you're supposed to wear that day, let it be properly ironed. Your hair up, packed up. Don't look at me, it's not me that said it, but that is the way it's supposed to be, to avoid a lot of things. So just dress well, pack your hair, let it be upright, like above your neck, not touch your neck. Your nails short, and every other thing set. Next one I would say is that just generally be teachable. Let's avoid the situation where maybe you don't know how to do something, and then you're assigned to do that particular procedure, for example, and you go there and you fall in front of the patient, and it might actually be costing the patient. So just to avoid all those a lot of issues, if they tell you to do something and you don't know how to do it, tell the matron or tell the nurse that told you to do it that you don't know how to do this, and so that she can put you through, or he can put you through, and it will be smooth for you. The ride will be smooth for you. They're having issues with the patient because you messed up. That is not, it's not really advisable. So normally medical sciences or medical courses, they have this thing with hierarchy. I don't know whether it's like that in every other field, but hierarchy is very, very important to them. So to us, when I say to us, yeah, because you always hear things like there's hierarchy in nursing, there's hierarchy in this, and there's hierarchy in that. So please, just to avoid issues, I would say the next thing to do is that always be very, very respectful. You don't have to communicate with someone that it leads to an argument. Try to avoid arguments as much as you can. Just try to avoid it because there's no point. There's no point. So even if it's in a case of they accuse you that you did something that you're not supposed to do, and you know that you were right, say it in a cool manner. But if you know that it's going to lead to an argument, just avoid that conversation, at least in the hospital. Avoid that conversation in the hospital. When you can talk it out in a comfortable environment, or when you can talk it out when the other person is a little bit calm, then you do it. It's better that way than to start having arguments in front of patients, and that thing can be very, very embarrassing and a big turn off. So let's just avoid that kind of situation. Like I will always say, like if you know me, I always say be have empathy for your patients. Just have empathy. I know that it might just be your first time of entering into the world and seeing a lot of things. Maybe it's your clinical posting, but then if it's your internship, you're better off because at least you know you have seen some things. Just be kind and be gentle and just do what you have to do with attend to your patients and all. But if there's any issues, try to avoid issues, please. If it's your first day or your first couple of days, so let's just avoid any issues. Even when you're starting working actively as a nurse, please, it's not needed. Next one is that obviously you need to have a journal. You need to have somewhere you're going to be writing on, so that because normally on the first day, the matron takes you around the world just to show you around so that you know where to get different things. If you need the BP apparatus, you know where to get it. If you need forms, you know where to get it. If you need charts, you know where to get it. So they just take you around the world and you know what each part of the world is for, where they keep stuff. So it's those kind of things and what they are used for. But tell you the uses of those kind of different things. They might tell you the uses of different things. So just for you to be writing them down and also some other information that might be important to you. It's just good. It just shows that you're being serious if you have a journal and something to write on. Yeah. Let's go back to the don'ts. What you shouldn't do in your posting, your clinical posting or during your internship. These are just some basic things that I have just three things that you shouldn't do. Please don't come late. I know that sometimes so yeah, there might be some things that can make someone to come late, and I'm not judging, I'm not claiming I'm perfect or anything, but I'm just saying that at least for the first day or the first couple of days, don't come late, and subsequently don't come late. I'm not saying you should come late subsequently, but don't come late, just so that you can have a good rapport with your seniors. Please, it's important. It's important. So yeah, please don't come late the first day, don't come late subsequent and subsequent days. The next one I'll say is what I said before. Don't pretend to know something where you don't know it, please. Don't pretend to know something where you don't know it. It's that can be very, very dangerous. That's just what it is. There's nothing for me to add. Don't pretend to know something or know a particular procedure where you don't know what it is. You always ask questions, always ask your seniors, even if you're going to be embarrassed. And then if you cannot ask in front of patients, wait when you're no longer in front of the patient or your superior is no longer in front of the patient, and then you ask. So yeah. Then the last one I will say is please don't forget self-care. Very, very, very important. Please, guys, please, nurses, and we need to like beg nurses at this point. We need to beg nurses at this point. Please, you push nurse, stop forgetting to take care of yourself. Please, stop forgetting to take care of yourself. And I know that the work can be a lot sometimes. There can be a lot of things going on. Please, after hospital hours, go home, take a shower, get rest, and then take care of yourself. Eat well. In Richard voice, make sure you eat well. Try to eat well. Eat well. After you eating well, just take care of yourself. Look good, please. Look presentable in a way. I'm not saying that you should have heaven and earth to look presentable, but at least just look good, please. I'm begging you. I'm begging people. Because sometimes nurses tend to look like what they are going through, and it's not good. Everybody's going through something. So please let's look good, please. Thank you. At the end of the day, guys, internship or clinical process is just to help you to grow into the kind of nurse you want to become. But no pressure, not overthink it. Just go, and you'll be okay. You'll be fine. You'll be fine. So I hope this video helped you in a way. Just remember that even if you make mistakes, you will obviously make mistakes. Even if you make mistakes, you will learn from them. You will learn from them. It's not like something serious is happening if you make a mistake. If you make a mistake, please accept the mistake and learn from it. That's just it. So no pressure, just go and you'll be okay, you'll be alright. So guys, this is it for this video. So I'll see you guys in my next video. Please don't forget to like, and I'll see you guys in my next video.